I am Dr. Renuka, Professor and Head of the Department Nephrology, St. John's Medical College, Bangalore. Here I want to tell you something very important about the kidney. There are two kidneys in our body and they are located in the back between lumbar vertebra L1 to L5, and they have an important function to play in our body. They have two important functions. One is the excretion, whereby they excrete the waste material from the body in the form of urine. And second important function is they produce certain hormones like erythropoietin and calcitriol, and which helps in calcium and phosphorus balance and maintaining the health of the bone. When the kidney fails, the important symptoms of the kidney failure will be the patient will have problem of tiredness, they will not be able to eat food properly, they will have nausea, and then they will feel weak and they will not be able to do day-to-day activity. These are some of the vague symptoms of kidney failure, and sometimes they are misinterpreted as gastritis and some other problem. Now, how do we suspect a kidney failure in a person? The patients who are above age of 65 years, those who have got diabetes long standing, those who are hypertensive, and those who have got a family history of kidney disease, or those who have got autoimmune diseases. In these sets of persons, if they have the following symptoms which I have told you before, if they are present, then there is a strong suspicion of chronic kidney disease, and we need to investigate for chronic kidney disease in these patients. Very often, young patients, they have these symptoms and these comorbid conditions are not there, then in them the CKD goes undiagnosed till they reach end-stage renal disease. Now, the most commonest cause of end-stage renal disease in India is, of course, diabetes, followed by hypertension and glomerular disease. And we, according to the CKD registry, which was done by Indian Society of Nephrology, and 50% of the patients are referred to nephrologists when they are in CKD stage 5D. So it is very essential that at the grassroots level, when they are seen by general physicians as well as the family physicians, they should know the subtle signs of kidney failure, and they should refer the patient early to the nephrologist. And now what happens when they are diagnosed as chronic kidney disease? There are 5 stages of chronic kidney disease according to National Kidney Foundation America, and generally from stage 3 onwards, if the patient comes to the nephrologist, they are better managed and the renal replacement therapy can be planned well in advance. So from stage 3 of kidney disease itself, when the GFR is between 30 to 59 ml, that is the time when the calcium phosphorus imbalance occurs and anemia starts. And that is the time when we look for these things and we start the treatment for chronic kidney disease, mineral bone disorder, as well as anemia. And when they reach early stage 4, that is the time we discuss with the family members about various options of renal replacement therapy, which are either hemodialysis or peritoneal dialysis or renal transplant. And we also discuss about the availability of donors and who can be donors from the family according to Human Organ Transplant Act. And similarly, and that is the time when we motivate the family and the patient to go ahead for early arteriovenous fistula, so that a lifeline is present in all CKD patients and they can go for renal replacement therapy as and when requirement is required. Now, the options for young patients, particularly those below 60 years of age, the best option for renal replacement therapy is renal transplant. And according to Human Organ Transplant Act, who can give the kidney is a person who is above age of 20 years and below age of 60, and they should not have diabetes or any cancer. Patients who are hypertensive but well controlled with one BP drug can be a donor. And these persons should be willingly come forward to donate the kidney, and they should have the same blood group as the patient, and this is very important. And as far as the other replacement therapy are concerned, now the science has advanced a lot. patients on hemodialysis, the survival 5 years is very much improving. More than 90% of the patients are surviving for 5 years, and even CAPD is a very good option for the patients who are working and those children who are going to the school. All these three treatment options are available in India in a fairly good economic prices, and many patients are now able to afford these renal replacement therapy. So as far as hemodialysis is concerned, the only disadvantage is the patient has to travel a long distance to the dialysis center, and they have to wait for the turn to get the machine, and then there are certain risks of hepatitis C because we don't have a vaccination for hepatitis C. Apart from that, hemodialysis is fairly safe and they can go ahead on long time basis on hemodialysis. Chronic ambulatory peritoneal dialysis has their own advantages. They can be done at the home atmosphere, and the patient can be ambulatory at home, and they can go for housework or business or factory work, whichever is patient prefers, and small children can go to the school. And this CAPD, that fluid remains in the abdomen for 8 hours, and after 8 hours exchanges are done. So 3 exchanges is required, and it is very convenient for the patient to do it, and no much expensive equipments are required. Renal transplant is the best option, and where the quality of life is very good, and the patient can continue with the medicines, and when they are compliant with medicine and instruction of the doctor, the half-life, what we call, is more than 13 years with present immunosuppression which is available.